If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic.
China has identified the cause of a mysterious pneumonia outbreak in Wuhan city.
Well, China's coronavirus continues to spread. Authorities are saying the outbreak could peak in 10 days.
In the epicenter of a now global outbreak, the death toll has been rising every day.
The arrival of coronavirus in Wales has been expected. This morning, it was confirmed.
It's going to spread further, and I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time.
The health of the public is paramount. Together, we can do this.
COVID-19 has created the worst crisis in education and learning in a century, affecting the lives of students of all ages. The disruption caused by the pandemic has had an unprecedented impact on students, teachers, and all aspects of education. It's been well documented that the drastic measures enforced to protect the public from spreading the virus, with travel restrictions and repeated and prolonged lockdowns across Wales, had a significant effect on the education, social life and mental health of students. Welsh Government, as with many governments in countries around the world, decided to temporarily close educational institutions, causing major disruption to learning and teaching. Schools, colleges and universities throughout Wales have been working hard to continue to provide education for their students, and they've been experimenting with alternative ways of providing teaching to their learners. Many academic institutions have gradually been converting their courses to online delivery through live online classes or recorded materials available to students on demand. This has been a real challenge for educators and students alike, due to time constraints, limited resources and technological issues. With COVID-19 changing life as we know it, and educators making decisions for the way forward, it is imperative to maintain high-quality educational outcomes from the newly implemented blending and learning and teaching techniques.
We've got some challenges to face up to during the COVID period, but we've also seen our academic community step up and deliver on an unprecedented scale.
It's disruptive in terms of the student experience, it's disruptive in the overall marketplace, disruptive to research, and I think it's fundamentally affected the way that people perceive higher education.
It's, in a sense, the biggest social upheaval in 75 years, the biggest social upheaval since World War II.
Well, the lockdown came as a surprise on the academic community. We had to adapt to a different mode of delivery.
It was a surprise to suddenly find ourselves not delivering the kind of higher education experience and the kind of working environment that we were used to with colleagues at very short notice. That's not to say we hadn't seen it coming. Clearly there'd been discussions about it, But I think the realization that we were all not going to be working from our offices and working from home offices was quite profound.
When the pandemic first hit, and when we were forced to work from home, there wasn't really time to kind of worry or get stressed or even kind of think about how we felt almost. It was all hands on deck. How do we adapt? How do we pivot? How do we change the way we've been working, for the last 10 or more years?
We have a situation where around about 80 to 90% of the revenue income for the higher education sector comes from student fees. And without student fees, then there's a massive chunk of money that institutions will effectively lose if those students don't come. Coupled with that is the fact that international students are a key part of the revenue stream as well for institutions. That has provided and caused a lot of uncertainty in the sector.
The impact on students really does vary a lot based on context. So many of our students would be based here in Swansea with us during this period, and many have not been able to do so. Many of our international students, for example, have been unable to travel, have had to have all of their education from Swansea University online. Many of our other students who come from the UK would usually experience a very different environment, one of face-to-face teaching and freedom to move around campus and so on. All of that has changed, so that even for students who are based here, who have travelled to Swansea throughout the period, they're still facing a blended approach to their learning, which is a mixture of online presence as well as some face-to-face activity.
Using tools that we weren't familiar with and recording lectures, and personally, I came to script a lot more what I was saying in my lectures. I think it's more precise. There is much more content, and I really much enjoy developing this kind of content now.
One of the interesting things about online teaching is that the discussions that actually take place on Zoom, for example, can actually be more engaging and more people take part in them than happen in the classroom, which was a surprise, which we didn't expect. But that's nonetheless how it seems to have been bearing out.
We're able to learn when we feel most motivated. For me personally, that is in the morning. So I would prefer to watch the lecture at 10 a.m. one morning rather than turning up to a 4 p.m. lecture on campus. That's when I prefer to learn, and it's given me that accessibility. And for others, it's the other way around. They prefer to do it at night time rather than turn up to a 9 a.m. lecture.
But it's also important to think about the impact on students' activities, their ability to socialise, the sports and music and arts activities that they might usually engage in. All of these have been disrupted during this period and have made it very difficult for the more holistic experience of a university setting to be enjoyed by those students.
I think before lockdowns, I am a very social person. I like to go out for food. I like to explore the cities, and I would naturally find myself outside, whereas some days now I feel like I need to force myself to go outside.
I have a lot of meetings with students who are kind of living alone. They don't, they're living in a foreign country, so that they don't kind of have any support network around them. And that's a really lonely place to be.
I guess in the beginning was a huge downfall on my grades due to not being able to have any motivation. When you study for 5 hours, go for coffee with friends, that disappeared. So I had to adapt to that, especially through my master's this year.
I do think we were one of the luckier years, because if I had my first year during lockdown, I would have definitely struggled to make friends. There was no interaction, and I did get a part of that student life in my first year. But then on the other hand, I wouldn't like to be a third year who was be graduating in a lockdown and missed out on their last moments in Swansea.
Course structures were designed around limited in-person lectures, and the creation of online content became mandatory. Students had access to virtual learning platforms such as Canvas and Blackboard, containing teaching modules, online lectures and seminars. Lecturers had to adapt quickly, both to learn and execute the new online processes.
And yeah, I do believe a lot of lecturers have helped and have done a good job and have done mistakes as well through this to interacting with students. However, they are learning from their mistakes as we are learning from mistakes. Like I have learned from my mistakes through summer being lazy, sitting around, doing nothing, to getting a routine, waking up in the morning. So it's a learning process that we all have to learn, and we're all humans, we all make mistakes, and so are lecturers, and so is the university.
Overall, Swansea Uni have done a great job of making sure we don't lose out on any education. Speaking to my friends from other universities, they have not had a good experience, whereas I can look back and say, no, I have had the best of both worlds, really.
Learning and teaching had to change quickly and dramatically. Educational staff had to find innovative and creative ways to continue their research.
Well, I think the impact on academic research has been very significant, both positively and in more negative ways, actually. We've got some challenges to face up to during the COVID period, but we've also seen our academic community step up and deliver on an unprecedented scale. Clearly, some of the challenges include the travel restrictions that our researchers are now facing, and for some of them who work overseas, that's been a real challenge. We've had to experience our labs being closed. Although we managed to open them as soon as possible, there were still periods where the labs were under closure because of COVID restrictions.
Swansea University contributed significantly, actually, during the pandemic. So right the way through to multidisciplinary and interdisciplinary teams coming together around research and innovation challenges to develop new solutions and products to support the efforts to fight against the pandemic. So it's been really inspirational to see the breadth of input the university has had.
I'm really proud to hear about these pieces of work. I wasn't personally involved in them, but I was aware that they were going on. And I think they were immensely helpful to the NHS, both locally and more widely, at a time when people were really scrabbling around for ventilators. There just weren't enough. We were very afraid that the surge would be worse, that first surge, than it actually turned out to be. We're actually having a worse time now with the second and third surges than we did with the first one here in South and West Wales.
Some of our staff have been seconded into the NHS during the first wave. Our final year medical students and nursing students all took up healthcare assistant roles and other types of roles in the NHS to help support frontline services. So there have been ways in which the university has achieved all sorts of things. With colleagues in engineering have been involved in a wide range of initiatives as well, for example. And we have colleagues in health data science who are leading disease modelling for COVID in Wales and contributing to the UK.
The support initially was quite quick, swift. We basically emptied our stores. Any PPE which we had, we supported the frontline health workers to make sure that they would have a safe working environment. But in parallel, we started many projects. For instance, we started looking at how can you sanitize an ambulance within 20 minutes instead of 45 minutes. We prepared sanitizers in large industrial quantities and made it available to the health service. We also had part of my team developing a community spirit of printing farms across South Wales, developing methods using 3D printers in garages, basically printing face visors. And overall, they delivered 16,000 face visors to frontline healthcare workers.
Our medical students almost immediately started emailing to volunteer their help as healthcare assistants and as, if you like, pre-doctors, because of course they've acquired quite a number of skills that are very useful and very beneficial at a time when the NHS thought that up to a third of its workforce was going to be off sick with COVID. So that was an amazing thing. Some of our younger medical students actually clubbed together to form an emergency childcare system for frontline healthcare workers who needed to get into shift works, the systems that would be difficult for them with small children.
The administrative teams were involved in supporting the university to redirect inquiries related to the pandemic, to field offers of donations from our alumni in support of some of the research and innovation projects that were going on.
So some of our students set that up, which again was amazing. And others were working both in the community alongside our district nurses and our GPs, also in the hospital as healthcare assistants, and the more senior medical students were working, and in fact we managed to graduate them a few months early so that they could be working as interim foundation doctors. And one of the things that I was left with was that if this is going to be the next generation of doctors, I think we're all in extremely good hands, having people who are keen, who are capable, who are enthusiastic, and who are unstinting in their giving of their time and their efforts to help other people. So that was just a lovely thing to see.
What I would say is that, everyone involved in the research projects that I've been working on, and other colleagues I know, it's just the resilience and the determination of research teams to still try to do excellent research with impact. But there are costs, and some of that's hidden. People are working longer hours. People are juggling home life. Many of my colleagues have small young children, or they have elderly parents that they've been caring for, and that I'm just humbled by the amount of effort they've had to put into their professional and personal lives.
The impact on education has been exceptional, leaving students fearing for their future, affecting their physical and mental development, social interactions and career prospects. While no one could have predicted the rapid and devastating effect COVID-19 would have on the education sector, the rapid responses from schools, colleges and universities ensured the continuation of their duties and generated positive outcomes through technological innovation, collaboration and determination.
This is the university of the future. It's going to be a blend of podcast and social interaction. and we really miss them, academics, and we also know that students really miss them.
I think actually we've all learned from it, both students and educators, and I think we'll see a real change in how we deliver teaching in the future. There will be this kind of division, as you say, of face-to-face teaching, but also then supported. So I don't think the level of face-to-face teaching will go down. I think we'll be at pre-pandemic levels. And I think we should be, because I think that is what students want. And also pedagogically, that's how teaching does work, through that face-to-face environment. But the addition of these supportive blended learning materials, which can then encase that face-to-face teaching.
Overall, I think our lecturers have adapted really well, and they've always been accessible by email. And I think having the pre-recorded lectures has made the education more accessible, because we can watch them when they suit us rather than turning up to a lecture on time.
I think the post-pandemic university might look a lot like the pre-pandemic university. I think that would be a shame. I think it would be a shame if we went back to doing all the things we did in exactly the way we did them before. I imagine we'll continue to deliver blended learning. I imagine we'll do more distance learning. I imagine the desire for face-to-face education will still be there. And because we're humans, and humans like human contact.
We've just embarked on a piece of work called The New Normal for the university. And that's really to take into account the fact that many of our staff, having experienced this period of spending a lot of time at home, have realised that they actually enjoy the opportunity to work from home at times. They enjoy the opportunity of being able to care for people at the same time as conducting some of the work they need to do. It's allowed a flexibility for certain colleagues, which I think they would want to continue with in the future. And we want to try and make sure that from a welfare point of view, we can accommodate that as best as possible. So there's a lot for us to think about in relation to what some do call this new normal way of working. But I'm convinced that many will enjoy being able to carry on with some of the flexibility that we've seen over this period. For others, of course, they'll be desperately keen to get back into the office where they enjoy the social interaction. So we want to be as flexible as possible in the future to accommodate the different views of our colleagues.
We can be optimistic for the future, knowing that our younger generations will continue to receive the right education at all times, no matter the situation. Learning and teaching have changed dramatically during the pandemic, which also exposed certain pre-existing problems and weaknesses of traditional education systems. The urgent need for viable and sustainable solutions has brought us forward and experimented with pioneering and revolutionary ideas that otherwise we would not have done for years or even decades to come. In that respect, learning and teaching might have changed forever. We have tasted the future of education, and it is up to us to study best practices and draw valuable lessons, reflect and make the long-lasting reforms needed for improving our education systems. The future of education can be bright and exciting.